Today we are planning for a few interesting procedures. Thank Michelle for agreeing for this. And the plan is, we are planning to do the upper and lower eyelid blepharoplasties and face and neck lift and platysmoplasty and chin implant and little bit of lip elevation by making a small cut here. This is the elevation of the lateral right side lower upper lip, the corner. See, if you see the left side, it's almost perfect. Right side, it came down a little because she underwent a small procedure in the left. How many years back?
Maybe 10
years back. So I think the depressor muscle were taken care during that surgery. So it's good for us because it's elevated. It's not making the lip corners droop down in the left side. But this side is little drooping down. So we plan to do a small procedure to elevate the lip corners. So we'll start with the markings. So what I'm going to write a lot in this your face. Really sorry, that gives us a lot of information during surgery.
Sure.
And we'll start with the eyelid first. Close your eyes. I'm going to mark the fold first. Open your eyes. Close. Open. Close. So this is my planned line of incision for the upper eyelid blepharoplasty, the lower incision. So for her, the more laxity is in the left side than the right. So you should not remove excess skin here. Close your eyes. Okay, this is the maximum depth I'm planning for. So I'll add on this lower margin. Open your eyes. Close. Open your eyes. Close. Open your eyes. Close. Okay. I'm not going to remove the upper mark because erring on little lower side is always better. So my cut will be this is the plan for the upper eyelid here. Now there is not much excess fat bulges here, so only plan is to excise a little bit of skin, a little bit of orbicularis and close this wound. Lower eyelid, if you see, there is a good tear trough deformity here. So it has to be filled. If you see, if I press it, all the fat pads are prolapsing. So medial, central, and let all the fat pads are prolapsing here. So we need to remove these fat pads and maybe fill this area with a little bit of fat so that it won't look odd. Same way, the whole the orbicularis is little lax here, so we need to tighten it somehow so that this membrane is disrupted during surgery and that orbicularis muscle is tightened. So this is the plan for her. So the cut going to be Close your eyes. Open. Close. Open. Yeah. Probably very little of skin I'm planning to excise, because after the tightening, the skin excision is not very much needed. This is the skin I'm planning to remove, and I'm planning to tighten the orbicularis muscle and put the fat in this region so that it look good. So this is the plan for the eyelid, and now we come to the nasolabial fold. The ideal is to mark the nasolabial fold now itself, because it is almost extending deep down to the mandible. So fill this area with a lot of fat. After the facelift, it goes like this, but still they need volume in the piriform fossa as well as these regions. Here we planning to do a small lip lift. So that this margin will move a little more up. So we need to mark the midline here for the chin implant. And same way we have to mark the chin crease. Then the platysmal bands. And if see not much fat here, I'm not going to do liposuction much in the neck because she already have a thin neck. Only thing is little bit the central the subplatysmal fat deposits here. I remove it manually, and jewel fat is here. Not much jewel actually, so I'm not planning to remove the do the liposuction for the jewel. So now we have to mark the incision. Can you turn to one side like this? So we'll do the trichophytic cut and the closure. So I'll go little above the hairline. So I'll make the turn in the groove, exactly the groove where the ear and the cheek meets. Since she doesn't have much of the deep sulcus before the tragus, I'll go retrotragal so that scar won't be visible much. Just go in the groove of the earlobe. I turn this side. Yeah. I'll go a little above the groove here. I'll go maximum width of the ear. That's the point where the incision turns to the hairline. From here, we'll make the turn. Just I follow the like hairline incision. This is also little above the hairline, so that scar is inconspicuous. Good. So one more marking we are supposed to do is Where is the zygomatic arch? This is for my own resection. Usually just below the tragus, before the tragus, this is a zygomatic arch here. So my smash cut will go just above the zygomatic arch, and there's a parotid here. So this is the parotid area. So my dissection is safer from here to here, and this is a sternocleidomastoid. So this is a sternocleidomastoid here, and that's it for this side. I'm planning to do the same marking in other side. Thanks Michelle for being patient, and this is the plan for you. And I think this video is going to be useful for the postgraduates and people wanting to learn face and neck, lips and blepharoplastics. Thank you.